The quiz will be starting at 10:10 p.m. Kindly join. Guys, we'll be starting the quiz at exactly 10:10 p.m. I hope everyone is ready. If you want to join the quiz, you can scan the QR code in your screen, or you can just go to our slide and type the code that is SO57I.
A few more minutes, guys. We'll start the quiz. So today's quiz is on gynecology, except tumors, STI, then contraception, and I think one more topic, right, Rupal?
Yeah, yeah. I hope I'm just let them, keep it guessing so that even we would know that if
Yeah.
they have read about it or not.
Hmm. So today
All
we'll be
right, guys.
having the rest of gynac.
Yes. I hope you guys have come prepared because we'll be starting the quiz exactly at 10:10 p.m. And as you know, it's a disclaimer right here, right now, that there are no negative marking.
5 more minutes, guys. We'll start the quiz. Please tell your friends as well to join.
Yeah, because we won't be waiting. We'll be starting the quiz at exactly 10:10 p.m. Hmm. Guys, you can join the quiz by scanning the QR code, or you can just go to AHA slide and put in the code. We'll be starting the quiz exactly at 10:10 p.m. Hmm. What do you say, Dr. Manoj? Less people, less competition, more chances to win, right?
Yeah. Or I think
Hmm.
they're waiting for 10:10.
Exactly at 10:10 p.m. they'll join, yeah?
Hmm. I think.
Let's see. 4 more minutes, guys. 4 more minutes.
What do you think? When would you join if you
I
were a
would be,
participant?
I am that person who want to be on time. So I'll be exactly at 10 and then, let the pace be. Because till then I would be like rereading or just going through my notes. Oof, I want to be on top and things like that. I'm gonna have this little
Hmm.
competitive spirit in me. So I don't, I would rather be on time and then wait than not to be on time and,
Hmm.
hassle.
Hmm.
What about you, Dr. Manoj?
I think it depends on my mood.
So you're more like the go with the flow guy.
Yeah, somewhat.
All right. All
Right,
right,
guys.
guys.
We have
Yeah.
12. Yeah, we have 12 players now. So let's wait
Mm-hmm.
for 3 more minutes.
Mm-hmm. Guys who are wanting to, watch it online on YouTube, you shall and you should. It's just if you would like to, leave your answers on the comment section. We are also fine with that. But getting into this competitive spirit is what is the real game, real deal. So I hope everyone is just, buckled up. Hmm.
Yeah, you can
So
always join the quiz and later see the live video because
yeah,
you'll be adjusted to the 35-second timer.
yes, that's a point. So we have someone who's silent as well, silent player.
Hmm.
All right, guys, last minute. Yeah, you're pretty right, Dr. Matun. These people are just 10:10 p.m. people now.
Hmm. Yeah, I think 2025 competition is too much. Will be too much, I guess.
Let's see.
Everyone's is so serious.
Hmm. All right, guys, last minute to go. Buckle up. Remember, each question will and can get you up to the leaderboard. Along with that, there is no negative marking. So it is a plus point for you. You can always put the answer and later you can also go back to your notes and see how was it and what was it. All right. All right, so should we get started?
Yeah.
All right, guys, so welcome back to this another exciting quiz of JuxtaMed. I'm your host, Dr. Rupal, and with me is today is Dr. Manoj. So let's begin the quiz. All right, so your first question is here. It's starting, guys, it's starting. All right. So, a patient presents with postmenopausal bleeding. Endometrial thickness on ultrasound is 6 mm. What is the best next step?
Yeah, here Endometrial thickness plays a very important role, but here the question says 6 mm, so not so straightforward. Let's keep an eye on that. The next step often depends on the measurement. Yeah,
Very good. Very good. So everyone has come prepared. Let's go with the pace as well. All right. So as we can see, guys, it's a cutthroat competition. Third place has been shared with the same points by two people. So it's a good going. And we have Heyman leading up with the leaderboard. Heyman, you can always put a, nice smiley face because you're on the top. All right. So keep going, guys. Let's go to your next question.
okay. Here, a 36-year-old woman presents with menorrhagia and dysmenorrhea for past 6 months. On examination, her uterus is symmetrically enlarged, tender, and soft. What is the most likely diagnosis?
Well, what do you think? I mean, there's tenderness, there's enlargement in the uterus. It gives some important clues. And what about the symmetry
Yeah,
of the uterus?
symmetry plays a very important clue here. Symmetrically
Right,
enlarged, tender.
right. These are the common culprits. Let's see what they got. Most of them have
Yeah,
got this right. I think few people were, not able to distinguish between endometriosis and adenomyosis, but ठीक है. You'll
yeah.
get it. You'll get it. All right, guys. So moving on. Hmm. Tables keep turning, and we have VSVP leading, then followed by Myra, Dr. Ro, then Reddy, S, Soumya, Ashish, Priya, Bhagya, Ram, Mohan, Kirti, Kavita, Dr. Tamil, Sureen, Hemant, Aditi, R, then Kumar, then Kevin. So it's a great going, guys. You're doing great. Let's keep up the pace and move on to your next question. Hmm. So it's a surgeon question. All right. So, guys, a surgeon is performing a hysterectomy, is concerned about a ureteric injury. At which location is the ureter at the highest risk during this procedure?
Yeah, I think this is the important one. This is how they ask. When performing a hysterectomy, the ureter is extremely vulnerable. But where exactly does the risk peak here?
It's all about knowing anatomical locations.
Yeah, so
Wonderful.
let's see. Okay.
All right, guys. Great going. Got this right. Moving on to your next. Oh, the leaderboard.
Okay,
Oh,
we
my.
have Myra now.
Yeah.
Myra followed by Docro, then Reddy, Soumya, Bhagya at the fifth place. Then we have Mohan, Priya, Kirti, Kavita, and Ram.
All right, guys.
Okay.
Keep up the pace. Remember, no negative marking. And let's go with the next question.
Yeah, here comes your fourth one. So, 30-year-old woman presents with painless vaginal mass incidentally found during a routine examination. The mass is located along the anterolateral vaginal wall. What is the most likely diagnosis?
Well, it does sound interesting. A vaginal mass with no pain located in the anterolateral region. Hmm. Incidental finding often point to something that's relatively benign in nature. But what could it be? What could
Yeah,
it be,
there's
guys?
a good confusion point here between Bartholin and Gartner's. Yeah, I thought of this.
Uh, guys, we're gonna keep a little tricky ones also. So read the question again.
Guys, I think if you go back and see, Bartholin's cyst is in the posterolateral location, I guess, whereas
Hmm.
Gartner's is in the anterolateral position.
Anterolateral. Right. That's right. So all right, guys. Little different, huh? Little. Hmm. Nice. Good going, Myra. So we have Myra with the longest streak, and then Soumya, and then Priya. All right, guys, you're doing great. Let's keep up the pace. Your fifth question. Which of the following is the strongest ligament supporting the uterus and preventing uterine prolapse?
Yeah, we all know that uterus needs support to prevent the prolapse, and I think the answer lies in the ligaments holding everything in place. Think
Hmm,
about the one that provides the most support and isn't easily compromised here.
right, right. I think it
So
helps a
that's,
lot.
yeah, the main support.
The main support, right? Nicey. All right, guys. So this is a base of your anatomy, and with this, we are on your fifth question. Let's see with the leaderboard. Mm-hmm.
Okay, Myra is leading with more points, and she has the longest streak as well. Followed
Yay.
by we have Soumya, Kirti, VSP, and
D-
Top Row.
All right, guys. So drum rolls a little for you all. It was so that you are keeping up the pace, and let's keep it up. Let's go with the sixth question.
Okay, we have a 75-year-old woman who presents with complete uterine prolapse and has no desire for future sexual activity. What is the best surgical option available for her?
Well, I think managing this kind of prolapse while considering the patient's reference, especially regarding sexual activity, surgery is definitely needed. But which procedure makes the most sense in this case? What do you think?
So let
Do they know?
I think let's see. Okay, we have 12 of them answering the correct one.
Mm-hmm. All right, guys, all right. You're doing great. Let's see. Tables turned. So Myra has just come prepared. I think Myra's favorite sub is Gynae. That's for sure. She's gonna be a gynae, probably. So, guys, you're doing great. Just read the question. Read the question. Just might get it. It's a little confusing. I get it, but you'll get it. So over here we have a 30-year-old woman undergoing IVF who develops abdominal pain, abdominal distension, nausea and shortness of breath 5 days after the trigger injection. Ultrasound shows a bilateral enlargement, enlarged ovaries, and ascites. What is the most likely diagnosis? What do you think?
So here the symptoms point towards a complication.
Hmm.
Bilaterally enlarged ovaries and
Ovaries.
ascites tell us a lot.
Uh-huh.
Yeah,
Nice. Very nice. Most of you have got this right. So this is good. Good going, guys. Moving on to your leaderboard. Uh-huh. So not much changes, I suppose. Great.
yeah.
All right, guys. Your next question.
A 35-year-old woman presents with failure to lactate and has amenorrhea and fatigue 3 months after a difficult delivery that required significant blood transfusion. So, what is the most likely diagnosis here?
Well, this sounds something like, or might be at play, like, something hormonal at play. Because I suppose it's a difficult delivery, as said. So let's see what
Hmm.
they got. Woo!
Yeah, all of
All
them
right.
isn't the right one.
Great. Great. I'm glad. All right, guys. Let's keep up the pace. Hmm. All right. Oh, what is this?
Okay, guys, it's a announcement today. So our OBG grand finale quiz that is on February 5th, 9 p.m. will be hosted by Dr. Oishika ma'am. So she's a PW Ops and Gynae faculty. So she'll be the quiz master for you guys. And
Yes.
yeah, so you can join the quiz, grand finale quiz by filling the Google form, which is given in the Telegram group and WhatsApp group as well of JuxtaMed and Dr. RMD. So the top winner will get a 25% of the cash money, and second place will get 15%, and third place will get 10% of the cash money. So you guys can uh, follow
Register.
our Telegram group and you'll get the link. Yeah,
Guys, as you know, it is a grand finale, and grand finales have to be grand, right? So we got this best, one of the best gynae faculty, obs and gynae faculty. And as you know, it's gonna be a blast since we are always there for you every day at 10 p.m. So we have for this grand finale, we've kept it a little special, as you can see at 9 p.m. So hope you guys are all ready and you guys wanna won this cash money as well, right? So be if you guys want to join and participate as well, you could always do that. Just we have a Google form, just fill that. And where will you find this Google form? You'll find it in our socials. That's our Telegram, then WhatsApp, then Insta, everywhere. We have got it everywhere. So just follow and ask, and it will be there, right? So be ready. I know, be ready. Here is your next question, all right? It's OBS and Gynae. Test your knowledge, guys. Test your knowledge. That's way better. So, all right. So, over here, we have a 39-year-old woman with heavy menstrual bleeding and abdominal discomfort. Undergoes HSG, which shows an intrauterine filling defect. Which of the following is the most likely cause of this finding? Guys, contemplate your thoughts with the x-ray that has been given.
yeah, this could point to some interesting pathologies, especially when considering the patient's history. Think about the condition that caused these filling defects on HSD. Yeah, it's
Hmm.
uterine fibroids.
All right, guys. You're doing great. Keep up the pace. Here is your last. Oh, here is your second last leaderboard.
Okay, we have Myra leading, followed by
Mhm.
Ashish, Kirti, Bhagya. Then at the fifth place, we have Reddy.
All right, guys. Great going. Good going. Let's keep up to your next question. The 10th question and the final one for tonight.
Okay, here a 27-year-old woman with PCOS presents with obesity, irregular menstrual cycle, and hirsutism. Her serum testosterone is elevated and her USG shows small multiple follicles in both ovaries. Which of the following hormonal finding would be the most commonly seen in this patient?
Ah, it's a classic PCOS case. Increased testosterone levels and then multiple small follicles. But what about her hormonal
Yeah,
profile? Ah, nice. Nice, guys. So most of you have got this right. It is true. It is LH, FH into 3 is to 1 ratio.
yeah,
You
guys,
have
can
figured
you
it
tell
out.
us when is it normal? What is the normal ratio here?
Hmm.
Those who are watching us on YouTube live.
Yeah, guys, you can comment also. There was a comment section over in the quiz also. You can do that as well. All right. So moving on to your leaderboard for tonight quiz. Ooh, and
Here we
confetti.
have, yeah, We have Myra as the winner of the quiz today. Congratulations, Myra.
Congratulations,
And
Dr. Myra.
yeah, then in the second place we have Ashish. Then third place we have Bhagya. So congrats to you two guys.
All right, guys. So this has been a blast. You guys have done great and keep up the pace. You can always join us every evening at 10 p.m. as well as the time we host this quiz. And remember, this quiz is it's like an amalgam of all of your NEET PG along with your INI. It's all these questions and your related topics which actually come in these questions. Along with that, in your day-to-day life, you can also encounter these. All right. So, guys, thank you so much and congratulations to all the winners. And remember, on 5th, we have a grand finale of OBGY, and do not forget to join that. All right.
Yeah, and thanks for tuning in today. So see you next time with more exciting questions.
Thank you, guys.